The latest figures from the Health Department show that the Northern Cape has almost 7,780 active cases, which is the second highest in the country after Gauteng. So the total number of new coronavirus cases recorded countrywide in the last reporting cycle exceeded the 4,000 mark for the first time since the 3rd of February, after 4,234 cases were recorded. Let's bring in now Professor Barry Schoub, who is the chair of the Ministerial Advisory Council on COVID-19 vaccines. Prof, a very good evening to you. Thanks indeed for your time. So I'll go back to what we're hearing about the Eastern Cape very shortly, but I want to start here. I mean, over 4,000 new cases in the last reporting period. We haven't seen such figures since February. Should we be alarmed?
I think we should certainly be concerned. We are entering into the third wave. In fact, in some provinces, if you look at the kind of metrics which the modelers use to kind of define a third wave, there are some provinces like the Northern Cape, as you just mentioned, and even Gauteng, which really meet the definition of a third wave. And I'm pretty sure nationally, we will be in a third wave. We're almost there now nationally.
Yeah, we're certainly picking up from the provinces that are already within that third wave, but our daily positivity rate just under 10%, 9.7 to be precise, and we have not yet gotten anywhere close to a fraction of vaccinating the population. Now, that study that you just heard about from the University of Fort Hare, from the acting dean for health services there, suggests that provinces like the Eastern Cape basically do not have the capacity to carry out the second phase, as vaccine sites are inadequate. Is a different strategy needed here?
Yeah, I think the key word which everybody was mentioning in that clip is challenge. This is a challenge, clearly. It's a challenge actually internationally to get to remote rural areas, and particularly in the developing world, and also, of course, in South Africa. So this challenge will have to be met by careful planning, using perhaps some kind of outreach mobile vaccination sites. And, you know, it will be difficult, and some areas will be almost impossible to actually reach with vaccination. There is one slight ameliorating thing, and that is that the epidemic is probably going to be very much less intense in those very remote rural areas for obvious reasons.
Could you elaborate on that, Prof, for obvious reasons? Why would it be less in terms of impact in those particular areas?
Because the epidemic is really most severe where there's crowding, where there's congregate settings, where people are concentrated to each other, because it's a person-to-person transmitted infection. And obviously in remote rural areas, those conditions are not quite the same as, for example, in the crowded urban areas. So the kind of difference in population concentration and intensity is quite different.
Being from the Eastern Cape myself, Prof, there would be certain areas. What happens then in remote rural areas where you do have quite a sizable population, because you'd often have one particular section where you have quite a lot of people. There are such instances in the Eastern Cape. What is done in instances like that, where clearly another strategy is needed, or to avoid a situation like, as you heard in that clip, where people would not be able to access these vaccination sites?
Yeah. Now, Griselda, this is, as I said earlier, a challenge. They will have to kind of plan very, very constructively how to get outreach with mobile vaccination facilities, or else taking into the kind of network of vaccination sites, those sites which are as close as possible to those concentrations of populations that you mentioned. Clearly, this will have to be done, because we can't afford to have certain parts of the country, regions of the country, even smaller regions of the country, which are not vaccinated and where the virus can still take hold and even generate variants.
What do we do in a situation like this, where we see rising COVID-19 numbers? There's also COVID-19 fatigue. I mean, we've been visiting quite a number of communities, my colleagues and I, since, Gauteng was announced to have already hit that third wave, just to monitor what the situation is on the ground. This certainly is seen to be potentially a driver of this third wave, which has already hit some of these provinces where there's so much COVID-19 fatigue. You often ask people why they're not wearing their masks, and you don't get a reasonable answer to some of those questions.
Yeah, this is really a problem, Griselda. You hit the nail on the head. There is COVID fatigue, but on the other hand, the epidemic is far from over. As you mentioned earlier, we are entering in the third wave. We are in a risky situation. So really, we have to kind of up our communication strategy. I think it's us as the professionals, yourselves as the media, and the combination. We need to kind of get out to the population that we are going into a risky situation. We have to kind of overcome that feeling of fatigue. We've had enough. We don't want to wear our mask anymore. We want to start socializing. But unfortunately, if we do that, we're going to drive the epidemic. And the third wave will be more severe than it needs to be. If we all do, it's human behavior will really govern the severity of the third wave. And we need to kind of engineer that human behavior so that it's it'll stop the severity, it'll minimize it, it'll reduce the severity of the third wave, which of course the winter season itself will also kind of help.
I mean, Prof, if the numbers continue to rise at this rate, the over 4,000 figure, certainly we'll be monitoring tonight what comes from the health department. Would South Africa need to consider tighter restrictions? At what point do we need to consider tighter restrictions?
Yeah, this is where that balance comes in, the balance between tighter restrictions for public health, infection prevention reasons, as against not damaging a fairly fragile economy. So they'll have to, again, think very, very smartly, what restrictions can be put into place which will be effective in reducing transmission. So, for example, I can give you some examples which have been thought of, which have been considered. For example, lengthening the curfew hours, certainly limiting the number of people in gatherings. I think that certainly is one thing which should be looked at quite seriously. Maybe alcohol sales is another thing. I think we need to kind of look very, very carefully what we can institute in terms of restrictions to limit transmission of viruses and yet not damage the economy too much, keep the economy going and allow for economic reconstruction.
At what point do we need to do that then, Prof? Because there was actually a story that we were scheduled to play before coming to you, but I guess we didn't have time. One of my colleagues in the Free State says that one of the hospitals in Bloemfontein is already full with coronavirus patients. The department is basically saying that it's concerned about the increasing confirmed number of coronavirus cases. When would you say, it would be best for government to really look at the situation that we're in? We're approaching winter quite fast. We're seeing the numbers rising. And of course, that needs to be balanced against what you say is, an already fragile economy where millions have already lost jobs as well.
Yeah, sure. No, Griselda, I think the timing is now. I think as soon as possible, I need to kind of look at restrictions. Because obviously, the earlier that one can dampen down the transmission of the virus, the better. We don't want to wait too long when it's established and more foci of infection or areas of infection which then propagate themselves. So the earlier restrictions are put in place, the better. So I think that the job of the department of the government is really cut out for it.
Prof, we really appreciate your time, and perhaps if you'd like to take a listen, we will be playing that story in just the next few seconds about what the situation is in Bloemfontein. Thank you very much, Professor Barry Schoub, the chair of the Ministerial Advisory Council on COVID vaccines.